back to my channel. So in today's video I will be talking about my traumatic birth and also my time in the hospital and my recovery time afterward. Grab yourself a drink, grab yourself some snacks, get comfy because this is probably gonna be a long video. Just a little quick disclaimer, I'm no way a medical professional. All the information that I'm giving you in this video is just from my own experience, and this doesn't necessarily mean that this will happen to you. Your hospital may be more equipped to these kind of circumstances, whereas I feel like I was a little bit misinformed, I wasn't told enough information, but that might not happen with your hospital, so this might not happen to you. So now that that is out of the way, moving on to my labour story. So before I even went into labour or anything like that, me and my partner Reese, we planned for a water birth. We didn't want any sort of pain medication, anything like that. That is what I wanted for my birth. I was open to it, so if I did feel that I needed an epidural or diamorphine, anything like that, then I was happy to have it. Obviously I've never had a baby, so I wasn't sure what to expect when having a baby. Be more open to the idea of having some pain medication if I need it. So talking about my pregnancy overall, in general it was really hard. I had a bit TMI, but I had UTIs all the time. I was getting yeast infections. I was constantly in and out of the hospital, in the maternity unit being monitored, had reduced movements a lot. I also had serious pelvic issues, so my pelvis was in absolute agony all the time, and I tried things. I did therapy, I used a band on my belly, I did other things to help prevent the pelvic pain. I used a pregnancy pillow, but nothing worked for me. Personally, it was just constantly getting worse and worse the bigger Malia, my baby, got. So because I went to see my midwife about my pelvic issues, she decided the best thing to do would for me to get an induction done. So if people aren't aware what an induction is, I think there's 3 stages to an induction. They do a pessary, then 24 hours later they do another pessary, and then they do a cream. If none of the following work, then they'll break your waters and put you on a hormone drip. Depending on what stage you are, the first pessary might work, so they might break your waters and then put you on a hormone drip. It just depends on how well your body takes to the induction period. Just jumping backwards a little bit, on the 18th of October I went to see my midwife. Had my first stretch and sweep from my midwife at my doctor's, and then she referred me to see a consultant at the hospital in the antenatal unit. She told me that I had to ring them myself, so I rung them. They managed to get me in for the appointment the 21st, which was a Monday. When I went to see the consultant, they pretty much just said to me the best thing for me to do would be to have an induction, so they booked me in for the induction on the Friday, which was the 25th. The Wednesday that week, which was the 23rd, I suddenly started to bleed, so I phoned up the maternity unit. They told me to monitor the bleeding and also keep a pad on and to call them back if anything changes. So I did actually phone Reese because he was at work, and I told him to just be on standby just in case we do need to go to the hospital, because the maternity assessment unit told me if anything changes then they might need to bring me in and monitor me. At 3 PM that day, I was just wandering around the house and then my waters broke. So I freaked out a little bit. I phoned my mum, I phoned the maternity assessment unit. They told me to come in straight away. I also phoned Reese to tell him, you know, you need to come home, we've got to go to the hospital. At this point it got to around 4 o'clock when Reese picked me up and we got into the hospital. The maternity assessment unit said that they wanted to put me on the monitors for a little bit just to check over baby, make sure baby's okay, because I was having some bleeding as well as my waters breaking. So they put me on the monitors, and then they also did an examination. When they did the examination, she said my waters didn't break, but my plugs come away and that I'm nearly 2 centimetres. She also said to me that I probably just weed myself, so just go home and just pretty much relax. By the time that I got home, it was roughly around 7:30 at night. I then relaxed and put my feet up for a bit, but by 9:30 that night, my contractions suddenly got very intense. They were very strong, very frequent, so I called the maternity assessment unit back and I asked them, what do I do? They said to me, just monitor your contractions for the next 2 hours, and then if they get more frequent and close together, give us a ring back. By the time I finished monitoring my contractions for the 2 hours, they were really close together still. They were less than 5 minutes apart. They told me the hospital that I was due to give birth in had actually shut their delivery department because they were full. I had to go to a different hospital to get checked on, and also with how close my contractions were together, they thought that they'd be putting me on a delivery suite. But as soon as I arrived to this other hospital, they examined me pretty much straight away. She said to me I was a definite 3 centimetres, nearly a 4 centimetres. Me in this little side room just until they had room for me on the delivery suite, just while I was progressing to a 4. Just because I was so close, they thought there's no point in sending me home for me to come back soon. And then from then on, it went downhill. I'm telling you now, it was the worst after that. From then on, shit got real. My contractions were getting very close together. They were 1.5 minutes apart, and also they were lasting for about 2.5 minutes. Bearing in mind I'm still in this side room and I'm in absolute agony. I was given diamorphine, I was given injections into my leg because I was being very sick. They weren't doing absolutely anything. I was just throwing up constantly. I tried to eat stuff, couldn't keep it down. I was just being sick constantly, and I was very dehydrated because I couldn't keep anything down at all. I think it was around about 4-5 o'clock in the morning on the 24th, a midwife came in to me and she said, I'm gonna have to walk your cervix forward. So that's literally where they just pull your cervix forward more towards your vaginal opening, just because my pelvis was sat very far back. So she said that she had to do that. She did that, and then I started bleeding very heavily, which obviously put me into more of a panic because I was thinking, I've never had a baby before, so I was like, is this normal? What do I do? So I just kept a pad on and I tried to breathe through it. In the time that I was in that side room, I was also in the bath, so helping to relax my contractions. It was helping to take away some of the pain. Due to give birth anytime soon, I definitely recommend getting a warm bath, or if you are wanting a water birth, definitely do it, because I feel like that would be the same sort of effect. It would help ease the pain. 4 p.m. on the Thursday, they finally had a room for me on the delivery suite. So they brought me onto delivery suite. By this point, it had already been 24 hours from the time that my waters broke, and they did break. My midwife that was with me, she went to break my waters, and she said to me they've already broke. They did send me home when my waters actually already broke. So they say within the first 24 hours after that, infection starts to set in. Thinking, oh my god, so they've sent me home when my waters did break, and now I'm at risk of infection because they didn't do their job properly. But I was in a different hospital than the one that I was giving birth in. The other hospital did their job wrong, but at least I know that I was in a good hospital now. When I got onto the delivery suite, I told the midwife that I needed to poo. For anyone that doesn't know, when you are in labour or ready to push or anything like that, you feel like you just need to poo. So the midwife wanted to then put me on the monitors to see how my contractions were doing, and also to see how baby was doing. They wanted to put a little pin thing in it, I don't know what it is, a little pin thing in her head to monitor her heart rate. When they put the monitors on me, they thought I was a 10 centimetre. So they did the examination when my midwife went to break my waters as well for me. They checked and I was only at a 4. centimetres. I was, felt so fed up, I was so tired. The contractions were the intensity of 10 centimetres, so I literally didn't have a break. I had no sleep, I was knackered. By this point I was labouring for over 16 hours, so I was just fed up of being in so much agony. So I said to him, look, give me an epidural because I need it. I had to put the cannulas into my hand. I had to have a baby anaesthetist put them in because no one could find my veins. Get bloods, it's hard to find my veins, so they had to get a baby anaesthetist to do my epidural for me. Did it so fast, and she was really quick at doing it as well. She said to me, I've got to be in theatre in like 20 minutes, so let's get this done quick. And it wasn't painful. When everyone would be like, oh my god, the needle's like this big, I didn't see the needle, so I can't tell you how big it was. Contractions were so painful that just to have the epidural, it didn't bother me. To have a needle in my back to do the cannulas, I didn't even know that she did it because I was just breathing through my contractions. If you want an epidural, just get one. After I had my epidural put in, I managed to get some sleep, luckily enough. But then after a couple of hours, I just suddenly felt this urge to push, and I started to feel the contractions getting very strong. So I told my midwife, and she topped me up with the epidural, and it's not done anything. And then we realised that my epidural disconnected. So the cord of it was dropping down over my bed and into my back. It managed to get wrapped up into my hair and somehow disconnected. We had to get an anaesthetist. Bloody hell, I can't say that word. We had to get an anaesthetist to come in and reconnect it back up and give me another top up for the epidural. During my time in the delivery suite, I had about 4 litres of fluid pumped into me. Because of me being sick so much, and because I was quite poorly, they pumped me with a lot of fluid because I was severely dehydrated. After I had my epidural reconnected back up, she checked me over, and I was 10 centimetres and I was 100% phased, so I was able to push. As soon as I started to push, my contractions slowed down massively. Each contraction was about 30 minutes apart. I ended up pushing for an hour and a half, but I only pushed a couple of times because my contractions were so far apart. So my midwife cranked the hormone drip to the max. After me pushing for an hour and a half, my midwife thought it would be best to bring the consultant in. She said to me, because my contractions are so spaced out, she wants to crank the hormone drip right up, and she wants to do forceps, which would have to be done in theatre. At this point, I was a little bit anxious because my nephew, he's had forceps done, so and I know she didn't have a good birth, so I was a bit anxious about it, but I thought if that's what I have to do, then that's what I have to do. She also told me that baby is actually facing the wrong way, so this is why they need to do the forceps as well, to turn her as they're pulling her out. The consultant left the room, another lady came in, and she made me sign some waivers just for the forceps and also emergency C-section, just in case I had to have an emergency C-section done. For all that, it seemed to go pretty fast. I then got brought down to theatre where they started forceps, and I was pushing, and they was using the forceps for about half an hour until he turned around and said, no, it's too tight, we need to do an emergency section. After that, everything just went into straight panic mode just to get this baby out of me. Everyone was quickly getting prepared to go into an emergency C-section, getting all the equipment ready. My anaesthetist that was above me the whole time, he was asking me if I'm okay. He was just constantly reassuring me that don't worry, everything's gonna be fine, baby's gonna be fine. And also he was there just in case I needed any sort of medication for anxiety, or if I felt sick or anything like that. He just said to me, if I need anything, just let him know. As soon as they started the section, he sprayed me down with this spray to see if I was numb, which I was fine, I was completely numb. But then as soon as they started doing the actual section bit, I started to become in and out of it. Because I was so in and out of it, I was also really panicky, so I said something to the anaesthetist, and I don't know what he gave me, but he gave me something, and it just helped me to calm down a little bit. During getting Malia out, they had to forcefully pull her out because she was already wedged in my birth canal, because I already started pushing and they already started pulling her out with the forceps. So he literally had to reach inside me and pull her out of my birth canal. Because he did that, he did end up tearing my uterus. So because it wasn't a clean cut, I then did start hemorrhaging. During the time that he was trying to stop the bleeding, he was putting a lot of pressure on my uterus. I could start to feel the pain come back, so my anaesthetist told him that he needed to stop immediately while we got pain relief put back into me, so that I wouldn't feel any more pain. Regards to the uterus, he actually took my full uterus out and he said, look, we're gonna have to take it out, and he cleaned all inside me and he cleaned my uterus down. He did put it back in. As soon as I heard we need to take uterus out, I went into shock. I was like, oh my god, I'm never going to be able to have babies again. They're taking my uterus out. I freaked out. But he actually did put it back in. He did put this bandage over my uterus. It was just a dissolvable bandage. I don't know what it's called. A bit like gauze. He put it over my uterus to help prevent any more extra bleeding. Obviously, I was bleeding so much. They did send for emergency transfusions because I was losing a lot of blood. I was in and out of it, and at one point, with the way that I drifted off, Reese actually thought that I passed away. Then the anaesthetist did start shouting things like, do we need to start crash response, which freaked Reese out. Obviously, hearing medical professionals say that they need to start crash response on me when I'm in and out of it and I look like I'm drifting off, Reese then went into a massive panic and started asking everyone what's going on, is everything okay, is she gonna be okay. They didn't start crash response. They just had it on standby just in case I needed it. At the end of the section, I think I had three blood transfusions and then 1 plasma transfusion. Altogether I had 4 transfusions. I lost 2.5 units of blood. I was in the surgery for about 2.5 hours, so it was a long time just because he couldn't stop the bleeding. Malia was completely fine. She was healthy. She was born on the 25th. She was 7 pounds 4 and she was born at 6:08 in the morning. So when we got back up to the delivery suite, the midwife that swapped over, she gave me a bed bath, and also I had a bit of skin to skin with Malia, which was nice. Unfortunately, I couldn't have it in my section because of everything that was going on. It was manic. The surgeon did come up to me and talk to me afterwards and explained what happened in the section. Obviously, by this point, I was still a bit dazed, so I remember bits of it, but he said that I had endometriosis and also that my pelvis is so tight that I wouldn't ever be able to have a vaginal birth. If I was to have another baby now, I would have to actually have a scheduled C-section due to my pelvis being too tight. After about 40 minutes of coming back up to the delivery suite, they then put us onto the ward where I was monitored closely because I did start spiking temperatures. So they said after a C-section, we just automatically put you on antibiotics because sometimes infection sets in place. During my labour, when I was in the delivery suite, I was on antibiotics already because of the whole, my waters broke over 24 hours, so they put me on antibiotics just to be safe anyway. On the ward, I was having conversations with Reese and I was so in and out of it and so dazed that I don't even remember the conversations. I still don't remember the conversations. Would say something to him and not have a clue what I've said. And when people were visiting me, I can't remember them being there. I don't remember having a conversation with them. It's very hard to explain, but I just felt so poorly that I was asleep pretty much all the time. I couldn't get out of bed. I couldn't move. And that was the same for the whole period that I was in hospital. That night, my midwife that was on duty, one of the senior midwives, realised that I was actually going downhill. So the following morning, she actually sent me back down to delivery suite for one-to-one care because I was getting worse. After a while of being on the delivery suite and having one-to-one care, I started to perk up a little bit. I did actually get out of bed and I was moving around, so she did send me back up to the ward. After that, I was really closely monitored, and so was Malia, because Malia's infection levels was up. She wasn't having any temperatures or anything, she just had high infection markers, whereas I was having temperatures as well. By day 3, they wanted to perform a lumbar puncture on Malia just to rule out meningitis, because she was obviously poorly as well, and they didn't understand what was up with Malia, so they did a lumbar puncture, which we received the results later that day, and they came back completely clear. That was positive news. She did start to show signs that she was getting better, so they did eventually take her off her antibiotics and she was fine. By day 4, I then got put into an isolation room. They thought that I had gastroenteritis. They later found out that it wasn't that. But I did get put into an isolation room for that reason. Between day 4 and 10, nothing really happened. They were just checking my infection levels. I was on IV fluids still. Altogether, I had about 8 litres pumped into me. I wasn't eating very much because I was being really aggressively sick. Unfortunately, too much information, but I did have the runs as well. During the whole time of being in hospital, like I said, I couldn't move. Reese was doing absolutely everything. He was amazing. I couldn't even shower, so he was showering me. He was looking after Malia. He was doing such a great job. Honestly, if it wasn't for him being in the hospital with me, me and Malia would have probably not survived. Wouldn't have been able to look after Malia physically. The midwives would have had to do it, but I feel so lucky and blessed to have Reese, who was there to do everything for us both. They also performed swabs in my mouth, nose, and also on my scar area. They just wanted to rule out pretty much everything, make sure that everything was that I didn't have any sort of viral infections or any sort of infection on my scar area. On day 10, they finally decided to do some investigating, so they sent me down for an ultrasound. But when I got into the ultrasound, the woman first did an abdominal scan. When she did that, she then was very aggressive and she bust my stitch. I was bleeding. Reese then obviously said something to her, and she turned around and was like, look, there's nothing I can do about it, just tell your midwife when you go back up to the ward. She wasn't apologetic, she was very rude. She then told me to go empty my bladder and then come back so she can do a transvaginal. She did that, and then she said to me, have you even emptied your bladder, because your bladder's full. I felt like she was such a rude woman. I just had to complain about her when we got back up to the ward because she was so rude. So she couldn't see anything because there was too much fluid there and too much gas. That was the results from the ultrasound. Then got taken off of midwifery care and got put onto consultant care. So I was people that was in charge of my care were the top doctors in the hospital, just because they kept saying I was a medical mystery. I was a bit of a random case that they didn't know what was going on. So the next day, on day 11, they decided to send me down for a CT scan to get a clearer image of everything that was going on. So if no one's ever been in a CT scan machine, it's literally just a little tube and you just go in and out of it, and you have to do certain breathing while you're going in and out of it. So they did the CT scan, and then I got the results a couple hours later, where they told me that I had a collection just above my uterus. So the option was that I would go back into surgery the next day and have a drain put in. So on day 12, I went back down to surgery. When I went in for the surgery, I was on my own, so I was really scared. I just had one of the ladies from up on the ward who was looking after me in the isolation rooms. She just came down with me. She was really lovely. She reassured me that everything was going to be okay and that the surgeon that was doing my surgery was really good. So they put me into a CT machine to do the surgery so that they could see everything that was going on. So he put me through once just to see where the collection was so that he could mark it up. So once he did that, I was pretty much in and out of the machine constantly. He got a needle, and I'm not even exaggerating, it was about this big. I'm sure it was bigger than what he needed, just in case. But he told me that the collection was 8 centimetres deep inside and also about 2 centimetres wide. He needed to go a little bit past it just to make sure that he was getting it all. So he placed the needle in and he said, as soon as you start to feel any sort of pain, let me know and I will numb you up. So because I was already really numb from my C-section still, I didn't feel him going in until he was about 7 centimetres deep inside, and then he just pumped me with loads of numbing stuff, I don't know what it's called. Took that out, and he then used a little syringe to pull out as much of the collection that he could, and then he sent that off to be tested in the lab to see if it grown anything. He put the drain in, and he had to use 3 different kind of tubes to like stretch my skin open so that the drain tube could fit in. Once the drain was put in place, I had that in for 48 hours just to be sure that it collected everything. After them 48 hours, a consultant came to my room and said to me, we're going to have to do another CT scan just to make sure that the collection is gone. If the collection is not gone, we will be bringing you back into theatre and opening you up the same way as a section, and we will be cleaning you out that way. By this point, because I had such a traumatic experience with the birth and the C-section in the first place, I was in tears, I was crying, I was so anxious, I didn't want to go back in for another surgery. He said to me, look, we'll just don't think about that at the minute and we'll just send you for your CT scan and go from there. I went back down for the CT scan, and luckily enough it came back saying that the drain had shrunk down enough for my own body to fight it off. So later that day they just removed the drain for me. It wasn't painful to get it taken out. Just a midwife did it. She just took the plaster off and just pulled it out, and it was completely fine. It was a tiny little hole. But from then on I started to show signs of improvement. I was actually getting better. They did say to me though, for me to be discharged, to not have a temperature for over 24 hours. Also changed my antibiotics because the results came back from the lab on the sample that the surgeon gave, and it actually started growing something. So they changed my antibiotics and they wanted to monitor me on them as well before discharging me. On day 15, the surgeon that performed my C-section came up to talk to me, and he told me that I had pelvic sepsis. By this point I was shocked, because around day 6, something like that, when we first got into the isolation room, I said to Reese, what if it's sepsis? And I didn't think anything of it because we checked the symptoms and I had none of the symptoms. But then finding out from the surgeon that I actually had sepsis, we was shocked, and we was shocked that they didn't do anything sooner. They didn't do anything until day 10, and he told me if it wasn't for my own body, then I might not have fought it off. He said the collection that they pulled out was just pus and blood. My body actually already fought the sepsis off. It just couldn't get rid of that collection, so it just sat there as a pile of blood and pus. So by draining it out, I started to improve and get better. Didn't have any temperatures for 24 hours or over 24 hours, so they said to me, I am free to go, I am discharged. So day 16 was my discharge day. I was meant to be discharged early morning, but because my medication took so long to be processed, I didn't actually get discharged till late evening time. My birth experience overall, I am suffering greatly with it now. than I did at the time. I've got severe anxiety and postnatal depression just because of what happened to me in that section. I'm scared to have any more babies now, which is rubbish because I had to bleed out on the table, or I'm scared if I was to get sepsis again. It is such a scary experience, and to be close to death on 2 different occasions was even more scary for me, and now I have this complete fear of death. It's what I'm suffering with now. Unfortunately, I have to just deal with that. I am doing things to help with it, so I do go to therapy and stuff. If you do want a whole another video on postnatal depression and anxiety and how to deal with it, then do let me know and I will do another video on that. My whole time in the hospital was, for me personally, a nightmare. Like I said though, I was lucky enough to have Reese there with me the whole time. He got given a bed, which was nice of the hospital to do for him. So he didn't once leave my side because I wasn't able to move. It wasn't till I was about 3 weeks postpartum that I was actually up moving normally. I was still in absolute agony, but I was moving a lot more. Regards to my bleeding and discharge during the time after having malia, the bleeding was fine, the discharge was fine, I didn't have any issues with it at all. The only issue that I did have is once my bleeding stopped at about 4 weeks, it then came back, but then it came back more aggressive and worse. I did have to get prescribed some more tablets from the doctor, which was stuff just to stop the bleeding, and that helped, and ever since that's been fine. My cycles now are a bit all over the place. I am on contraception, so that does help to balance it back out again. Still suffering with random bleeding and stuff like that. On the term, it's been nearly 7 months now and I'm still suffering, so overall my birth was really rubbish, and they told me that I can take up to 1.5 years before I can be fully recovered from my section and also the sepsis. Your body repairs itself. I'm not a medical professional, so I don't know, but at my checkup they said to me that I conceive anyway for another 1.5 years. So thank you for watching my video on my birth story. If you want to see any videos about postnatal depression or anxiety, just let me know. Give the video a like and also subscribe down below, and I'll see you in the next video.